Hi and welcome to the Anti-Waffle podcast with me, Embel Shonela and Marva Gregoro de Souza. And together we will try to talk about research without any gobbledygook. Each episode we'll be talking to a researcher who will discuss the work they're doing, looking at why this research is important and asking how do they get into this field. We hope that it will be informative and interesting and bring a bit of the academic world into the real world. This week we have Dr Ilan Kelman, based at University College London in the Institute of Risk and Disaster Reduction. Hi Ilan, welcome.
Hello, thank you.
Thank you very much for being here. Would you like to start by talking us through your research and the areas you look into?
So, as you mentioned, I'm here at UCL, University College London, and very fortunate to be cross-appointed to two institutes. So I'm in the Disasters Institute, the Institute for Risk and Disaster Reduction, half my time, and then half my time within the medical school at the Institute for Global Health. So it's a very exciting opportunity to be able to bring together disasters and health research.
How do you combine the two? Do they actually combine, or the two areas?
This is excitement and this is a challenge, and what we tried to do is come up with certain bridges in order to bring the topics together. So one example is that before I came, I was working on projects called disaster diplomacy. We were looking at how and why dealing with disasters, both before and after, actually influences peace and conflict. I also discovered after coming to UCL that there's a whole field of health diplomacy, medical diplomacy, vaccine diplomacy, basically looking at whether dealing with diseases, dealing with outbreaks, dealing with epidemics, dealing with vaccinations can be done in a war zone. Does it bring peace? Does it help people come together? So therefore, I can use diplomacy as a bridge between disasters and health through disaster diplomacy and health diplomacy. Another example is climate change. So climate change very much permeates a lot of the development discourses, a lot of what practice and policy is aiming at. Climate change influences many hazards, it is changing the weather, and it also impacts health. So supported by the medical journal The Lancet, as well as the Wellcome Trust, we have a very large project on looking at indicators for climate change impacting health. And what I'm doing for that is actually looking at migration. Are people moving because of climate change? Are there health impacts on it? And we're considering both physical and mental health. So therefore, climate change, it impacts weather. Can we deal with it? Is the disaster side? Then the health side are the health impacts, so climate change becomes a bridge. And a third one was we're very, very fortunate to have the world expertise at UCL on disability and disaster. So there is a very strong disability studies program, people who are looking at people with disabilities and ensuring that their needs are met. And on the disaster side, we then need to think about people with disabilities, not only in disasters, although that's important, but also how they can contribute to society and to themselves before disaster strikes. So we work with people with disabilities to say, well, what do you need? What do you want? How can society help you? What can you contribute to society to prevent disasters as well as during response? And this covers a whole range of people with disabilities. It can be mobility, it can be intellectual, it can be cognitive, to ensure that everyone is contributing to society and no one is left out with regards to disasters. So this brings together health and disasters, and we hope we can contribute that way through research and science.
So are you saying like you bring everything together, and so then you're looking at sort of like more holistically, so you're looking at not just, okay, so what happens if we have a disaster, and are we talking about like natural disasters? Is that what we're talking about? So like if there's a tornado or a tsunami or a fire, how is it all sort of like just natural disasters, and how we deal with them and how they affect us on every level?
Well, we are very much encouraging everyone to avoid the phrase natural disaster on the premise that the tornado, the earthquake, the tsunami comes from nature. But It is us who place people in harm's way. It's us who build infrastructure that collapses. It's us who has the policies and the politics and the societal aspects, which means we cannot deal with nature. So The disaster is us. The disaster comes from society, not nature. So when we talk about holistic or very wide views, one of the fundamentals is we say, let's try and avoid calling them natural disasters, because then people will not blame nature, but they'll blame ourselves. And this is very much how we try and approach what it is we're dealing with regards to science and society and ensuring our science serves society. It's the same with health. There's so much which we cannot deal with in our own health, and there's so much that we can. So let's take responsibility, not just individually, but also collectively, and say, what are we looking for? With both disasters and health, fundamental baseline is prevention is better than cure.
Right.
It saves lives, and it's actually also cheaper. So the more we put into preventative medicine, the more we put into disaster prevention, the better we do for society and the more money we save.
Why is that important for the natural aspect? So if there was a train disaster, that is not natural, that is something, it's a man-made thing, so that's something. Do we have to then approach it differently to a disaster that has come from a natural aspect?
Well, what we're finding is the answer is no. And yeah, we prefer calling them human-made because part of what we're doing and part of the bridges is also equity, and that includes gender equity, racial, ethnic equity. What interestingly, in human history, what appears to be the most lethal train disaster was actually on 26 December 2004, when the Indian Ocean tsunami struck Sri Lanka and it took out a train. And the death toll was on the order of 1,000. I mean, it's very hard to know exactly how many. And that was actually one of the most lethal train disasters, if not the most lethal in human history. So even if we're talking about transportation, is it really the natural hazard? Is it what the environment is doing? Or is it the fact that there was no warning system at the time for Indian Ocean tsunamis? If an airplane goes down because of a lightning strike or wind shear, or it flies into a storm, there is that natural hazard, but why did the plane fly into the storm in the first place, rather than having weather radar, rather than having warning systems, rather than having pilot training? So directly to your question, the fundamental causes of all forms of disasters do tend to be similar. And it's not nature, it's not the environment, it's not the hazard, it is human decisions. Typically not an individual decision. It's typically politics, policy, collective approaches, human values, behavior, and actions which put people in a certain situation that they act in a way to increase vulnerability, or they cannot act at all because they don't have the choices, they don't have the resources, they don't have the opportunities. There's very logical, rational reasons for why people in the poor neighborhoods of Mexico City are living on the slopes of an active volcano. It is not that they're stupid. It's not that they are unaware of the volcano. It's not that they are ignorant of the history of eruptions. It's that they have no other choice. So what creates poverty? What creates underdevelopment? What creates discrimination? What creates oppression? These are all human conditions for which it may be very easy to blame nature, but that's not correct. So by calling them all human disasters, we get away from this idea that they're natural or they're acts of the data, exactly, that we can't avoid them because we have a choice. And the areas where I tend to work in, I very much focus on islands. So there's a field of study called island studies, where we look at islands and islands in relation to other areas. And also my particular specialty is the Arctic and Antarctic, so polar regions, of which many are islands also. When we have supposedly smaller places and supposedly smaller populations, a lot of these ideas come together. And we can see the difference between building for earthquake resistance and not building for earthquake resistance. Having a tsunami or flood warning and not having a tsunami or flood warning, as well as the connections amongst all these topics like disasters, development, health, sustainability. So coming into these generally smaller areas with more confined populations, these lessons are actually so much more obvious. They become very clear in the research. And so by working on islands and working in polar regions, we can really have very strong, exciting, important lessons for places like London, which is what, officially 7 to 8 million people, unofficially maybe 10 or 11 million people. Very hard to connect some of the issues, very hard to bring them together unless we've precedents and unless we've lessons from elsewhere. So even the UK, London, which experiences storms, which experiences floods and even earthquakes.
Yeah.
Certainly not recently huge ones, but enough to cause some damage, and people feel it. We have a lot to do here, particularly by recognizing that we should be doing much more to stop the damage, disruption, and deaths from the environment by avoiding the phrase natural disaster.
Is the research you're doing to advise people to prepare for these events, and are they listening to you?
We do our best to make our science relevant for society. We think that our research should serve the people and should have a positive influence on policy, on politics, on what people do. We are very fortunate being in London and being at a prominent university, so we do have access to decision makers, and that's politicians. That includes lords, that includes MPs, but it's also for the people, just ordinary people who may never think of going into politics or decision-making roles. So it is about that person in the street. Can you learn first aid? Should you learn first aid? And that's physical first aid as well as mental health first aid. How can we encourage you, all of us, together to work to make the places and our cities and our streets safer for both health and disasters? And there's some very simple things. So in London, we have photos of streets which are flooding in a rainstorm because leaves and litter were clogging the drains. So can everyone take a role in not littering? Can everyone take a role in cleaning up leaves? What about checking on your neighbors? Not everyone has the same advantages, choices, or opportunities as all of us. So are we aware of who is vulnerable, who is there, and how we can help them help themselves? Also, a lot of our role is education. Both my institutes run master's programs. So in my Global Health Institute, this year we have over 100 master's students. In my Disasters Institute, we are just over 40 this year across several programs. And when we look back across the years, I see our former students with the UN, with local government, in the private sector, with engineering companies, with business companies, and with the non-profit sector, international non-governmental organizations, and local charities. They are now making the difference. They are on the front lines, creating the policies, doing the actions for both health and disasters and wider contexts. So we hope that in the master's programs we bring to the classroom the enthusiasm and the passion which they all need to navigate the world in its all daily manifestations and all the difficulties which they have to encounter regarding resources, regarding decisions, regarding having that influence. And through our students, through ourselves, through working with the media, through the public, we hope to inspire and involve everyone in trying to make our cities, our world, healthier and safer.
It's not just influencing the big people and the big groups, but what people can do for themselves and just what normal people can do.
Yeah.
We certainly hope and try.
Yeah.
Because prevention is better than cure.
I can't think of any initiatives that the government put out for some of the comments you made. I think they were really simple things like the litter and because I hate litter. And I brought my daughter up not to drop any, not even one little piece. If you miss the bin, then go back and pick it up and put it in properly. And it's like, so for me, that's a big issue. And but my point of view from that was always, well, why do you want your city to look like a rubbish tip? Why would you want to do that? That's always been my point of view. But that's an excellent point of view that, well, if the drains weren't so full with rubbish, there wouldn't be as much flooding. And no one likes the flooding, no one likes to have to look for somewhere else to park their car or whatever. But I haven't seen that one out there. Like, so how are the...
Yeah, they haven't advertised as that point of view of what part you're playing in something bigger, I suppose.
Yeah.
But see, you're doing it by telling your daughter not to litter.
Right.
And this is what we need. It works with everyone, and we all have to come together. So individuals can make a difference in litter.
Right.
Individuals can make a difference in first aid.
Yeah.
But we also need the wider scale structures, non-profit, private sector, and government, to deal with wider issues like terrorism.
Yeah.
And whatever an individual did, it would have been very challenging for any individual to avoid the appalling situation at Grenfell Tower, which is simply a fire.
Right.
But an appalling fire, which should never have happened,
Right.
which had an insanely high mortality rate, and the root causes of fundamental issues are still not being addressed.
Right.
So that's where we actually need media, government, private sector, nonprofit to get on board and say, why don't we admit openly what really caused Grenfell?
Right.
About social exclusion, about lack of investment in infrastructure, about societal structures which simply marginalize poor people and don't really meet their needs. Because the flames killed, but the root cause of the disaster was much deeper and much wider. And as individuals, the three of us sitting around this table can lobby. We can vote. We can talk to the media. And that is part of change. But we also need those with the power, those with more resources, those with more choices to make the change we seek. Because whether it's the fire at Grenfell, whether it's the fact that I cannot walk to work without passing a homeless person, whether it's a lot of the issues that we're seeing nationally and internationally about people who are marginalized, discriminated against, this is what we all need to work for solving, because this tackles vulnerability. And it's vulnerability, not nature, which causes a disaster. It's vulnerability which leads to many of the health concerns that are prevalent. Are we willing to join forces and work together, doing what we can as individuals, hoping it will scale up and influence those in Parliament, in the media, with the resources who can make the change which we want to see.
I like that. It's vulnerability, not nature, that causes disasters. So you were talking about the prevention rather than disasters that go on across the world, and then countries will then support each other, and everyone will call for help, and people will send people from all over the world and send money from all over the world to help. So that system is in place, even if it's unofficially in place. So what do you think would need to be done to have a system of prevention in place that is then where everyone sort of like just gets on board? Do you think that's possible?
This is a fundamental research question, and you've absolutely nailed it perfectly, because ultimately, I don't know at this stage. We certainly have a phenomenal list of good practice examples. We have many successes from around the world, and from poor places, from rich places, from all continents, from all approaches. Can it work globally? Is it doing what we need? We're not really certain, and these are the debates we have. We have master's students who do dissertations on this. We have PhD students who do dissertations on this. We're continually talking to decision makers, continually doing academic papers to try and say, are we winning the battle against risk creation? Or is disaster risk creation actually outweighing the good news in terms of reducing disasters and reducing disaster risk? It's the same with health. When we talk about obesity, when we talk about malnutrition, when we talk about preventable diseases, particularly infectious ones, how are we doing? Well, we've no deaths from smallpox. Polio is only in a few countries. Same with guinea worm disease. That's only in a few countries. And measles and rubella are being targeted also for eradication. When we look at health overall, in many countries that has improved. In many countries, what's called the double burden of obesity and malnutrition still exists. So this is a balance. What we do know is there's a long way to go. What we do know is we've many successes. And what we do know is what we're meant to do. Are we getting better overall over the long term? It's up for debate. Hopefully everyone will join us to try and work together to ensure that we do reach those successes, that we do stop disasters, and that we do improve health, and because we need everyone on board in order to achieve this.
What strikes me is that your area of research could sort of be part of everyday life and every bit of research actually that's happening elsewhere, especially the research I know at UCL, for example. It's, the doctors we've got working in the medical school on looking at their research into obesity and other illnesses. It must sort of, it touches on what you're doing as well, and it'd be really, do you collaborate across, do you have all the different departments? It sounds like such an important area, and just it could reach out.
It requires large teams, and it requires vision. And the directors of both my institutes are very much visionaries. By reaching out and creating the joint appointment which I have. By reaching out and building teams for different projects. So the Climate Change and Health project which we have involves several dozen primary people across 5 working groups and international collaboration for many continents. We need it because one person cannot do this. And similarly with my Institute for Global Health, the director there is leading a commission on migration and health, looking at health impacts of migration, looking at the health of migrants. And this requires a large team. So we have doctors, migration specialists, global health specialists, and people looking at refugees and other forced migrants. Because we all have knowledge, we all have skills, we all have expertise, but we cannot do everything. So we need to combine them, pool them, bring them together to communicate to the wider public and to publish academically to ensure the science is correct. But as much as we do our best to reach across boundaries, as much as we do our best to reach across UCL, we need more. So we need the public involved, we need the politicians involved, we need businesses in the private sector. We all have something to contribute. Can we do so constructively in order to move forward in a positive manner? And this is why UCL is so exciting and why both my Disasters Institute and my Global Health Institute are world leaders. Because they break down the barriers, they bring in all disciplines, skills, expertise, ideas needed to produce that world-leading cutting-edge science, but ensuring we are always serving society.
And if people did want to get involved, say they were listening to the podcast and there were businesses or even just everyday people that wanted to, how would you advise them to start?
Well, please contact us. Let us know what interests you. Let us know how you would move forward and what you could offer us and what we could offer you. I'm on Twitter. My handle is @Ilan Kelman, just my name. So that's ILANKELMAN. You can look up our institutes online, Institute for Risk and Disaster Reduction and Institute for Global Health. See what the expertise is there. And it's everything from dealing with diabetes in Bangladesh to trying to understand and analyze the statistics of earthquakes in Italy. Not everything will interest everyone, so find something which does interest you, drop us an email, pick up the phone, contact us through Instagram or Twitter, and let's see how to work together.
So you listed like about 4 areas that you're actually sort of like involved in and that you're trying to push through. If you had to dilute it down to just one thing,
prevention is better than cure.
Yeah.
Come and join us in this approach.
It is. No, I totally agree with that. I tend to. Yes, I'm one of those people that if I'm at a table and if I'm out eating with people and I see that their drink's like close to their arm and they're talking and I will just like move their drink away. So it's like, that's what I'll do. Yeah.
What the arms about?
and this is actually, we can laugh about it and fair enough, people will think, well, hang on a minute, are you really? But on the other hand, this is every day.
Yeah.
Small things, prevention is better than cure.
Yeah.
And so much, although we are well aware of the disasters which hit the headlines, the Nepal earthquake, the Caribbean hurricanes, the Indonesia tsunami, but it's actually the everyday which affects people more.
Right.
So simply walking down the street and experiencing sexism, racism, or homophobia or other forms of discrimination.
Yeah.
Simply having a government make decisions for you such that you cannot control your own day-to-day life or your own day-to-day choices for things which are important for prevention is better than cure.
Right.
It always comes down to a balance. It is not that everyone should have complete individual freedom. It's not that every government should be controlling everything the citizens do. It's always that balancing. And to say, but what can we do which is legitimate and constructive day to day to reduce vulnerability, to help people? What is it that influences us day to day, which makes us contribute or not to society? How can we deal with that in our patterns at the dinner table or in voting? And therefore, by dealing with these root issues, by tackling vulnerability, by simply admitting where disasters and poor health come from, we do have a lot of evidence that will scale up to avoiding these huge disasters, which then hit the headlines and people start asking, well, why didn't we do anything before?
Right.
The time to start doing something before is now.
Right.
How did you get to your current position? Sort of, where did you start from, and how did you end up in this area of research?
I was always interested in a career which would contribute to society. And I considered all sectors, so absolutely academia and science was on my list, but so was government, so was the private sector, so was a non-profit. So I sort of had to thought, well, what am I going for? What suits me? And fundamentally being constructive, contributing to society, but it also had to fulfill me, which meant I wanted it to be international. I wanted it to be challenging, because I get bored quite easily. So even though some problems are fairly simple to solve, I am happy to let other people do that. And again, it had to have this foundation of making a positive difference. So I tended to keep myself as open, as generic, as general as possible. And my first 2 degrees were engineering, which I felt would permit me to develop the skills, to develop the understanding which could be applied in multiple areas. Then after my engineering masters, I really discovered that disasters were of high interest because there were unfortunately so many, and there was a very strong contribution to be made. And I've also realized that islands were very important to me because larger countries, including the UK, should be able to deal with their issues. Huge population, huge resources, amazing expertise. The fact that we're not, well, that's what we've been discussing earlier. But does the UK really need external help? Well, it does, but in theory it shouldn't. Compared to islands which have a tiny population and very few resources, one person can make a very positive difference. And the islanders are asking for this help. So throughout my master's, when I sort of brought together these issues of islands and disasters, I realized, you know what? This really fulfills my criteria. I believe I can help constructively. People, including myself, are asking for this sort of help because it's also about helping myself. It's not just about everyone else. It was international. And yes, boy, is it an incredible, incredible challenge with so much work yet to do.
Yeah.
So I was very fortunate after my master's to be able to get a job working with islands and disasters. So I actually worked and lived in Barbados for almost a year, which gave me real grounded experience working in the Caribbean regionally, recognizing some of the problems which the classroom could not bring to us, and simply learning a lot. And as my contract was coming to an end, I thought, well, now I can really focus and pick something which works for me. So I was applying to all sorts of different things. And one of the things which I applied to one week was actually PhD, opportunity advertised. I thought, oh, that sounds interesting. You know, it's 3 years, it's in my field, I get a degree out of it. And I was very fortunate to go for an interview, get offered it, and do my PhD in 3 years on island disasters.
Oh, perfect.
Particularly looking at East Coast flooding for England. So when the North Sea has a storm surge, it will hit islands like Canvey Island on the Thames and many of the East Coast cities. So I was looking at building collapse in that scenario, which brought together engineering, architecture, planning, geography, human values, human decisions, human behavior, and really realized that I could create a pathway with my collaborators, with my mentors, saying, bring these areas together and do something for society. I also recognize the power that academia can have. We are very fortunate to be able to speak our minds to a large degree, always trying to be constructive, hopefully, always trying to contribute to society, hopefully, but using science, using knowledge, which maybe no one else has, to try and change society for the better. So that very much appealed to me regarding a career. And again, after my PhD, I was very fortunate. I was offered an academic possibility, I was offered a possibility at the United Nations, and I was offered a possibility in the nonprofit sector. And I really had to think, well, certainly the private sector was missing from those opportunities. Do I want to pursue it? Do I want to go United Nations or nonprofit? Do I want to think more about government? And ultimately I felt I could bring together all those sectors. I could bring together all those areas. I could continue to have an international career, a challenging career, and a positive difference, particularly by being through academia. Especially because we do the science, but we do the teaching, and we do the public engagement. And again, bringing all those together to me really had the force, really had the power to say we can stop disasters. We can improve health. We know what to do. We have the knowledge.
Yeah.
The real fundament, why are we not in many cases? And why are there many positive examples in many cases? So this to me was the stimulus and the impetus for an academic career, because again, it kept me basically broad, general, generic, where I could do everything, and working with absolutely marvelous teams who have so much which I could never have and I don't have, in order to try to do better for our own back gardens and for the planet.
Right. And it took you from Barbados to Canvey Island.
Yes, which again
I never thought I would put those two in the same sentence.
Brings together the island ethos
It does.
and brings together islander approaches. Looking at, again, what is vulnerability?
Yeah.
Why does it
it's
occur
true.
similarly in those places? And again, the Arctic. So many islands in the Arctic, such as Greenland, Baffin Island, and much of the Norwegian coastline, to recognize a lot of the challenges are similar.
Yeah.
So how can we work together to learn from each other and to support each other, including the megacities like London?
Yeah. And I suppose as well, it's kind of like looking at an island, it's kind of like the difference between having a small rowboat and having a big ocean liner. And if you want to learning to turn the small rowboat, well then if you learn, okay, well these are the steps that we need to do, so you can try something in the rowboat quickly. Oh yes, no, it works. If we lean to this side, it will go. Oh no, if we lean to this side, it will capsize. And so it's you've got the it doesn't take so much time to learn what works and what doesn't work. So you can actually test things, and then once you've got, oh no, well actually this works, then you can then take it to the ocean liner, which actually takes a long time to turn. And yeah, so it would take too long to find out if something isn't working.
The baseline, the physics are the same for that rowboat or ocean liner.
Right.
And the baseline of disasters and health, vulnerability.
Yeah.
Human values, societal structures which force individuals into certain decisions, into certain constrained options. So by learning, we can hopefully apply it much more widely.
And what would you say your greatest achievement has been?
Well, I hope that I'm not necessarily there yet. But ultimately, I would say that what I try to do, and throughout my whole work, is to make my greatest achievement bringing people together, positively and constructively, so I learn from them. I hope I teach, but it's always an exchange. And even when I'm standing up in front of a class, and sometimes it's 10, sometimes it's 100, it can be an hour, it can be 3 hours, it's always an exchange. I find I cannot teach without learning. And hopefully when I learn, I teach. So ultimately what I hope my and others' greatest achievement would be throughout the career, throughout life, is bringing people together positively to move forward and simply trying to improve what we have as a human species, what we have as one planet.
Round up to tell the public why your research is so important.
We think that our science is important because it contributes to society. It can also hopefully involve everyone on terms which suit them and on terms which then bring them into contributing to society. Do we save lives day to day? We hope so. Some of my colleagues absolutely. They can quantify how they've reduced infant mortality in specific communities. They can quantify how their research in emergency preparedness and emergency planning and management have changed how certain governments, municipal structures, have responded to disasters and saved lives. And that's important, but it also has to go beyond simply individual lives in terms of saying that what we are doing is important because it serves, or at least should serve, everyone. And get involved in government, whether it's voting or standing for office. And then we can provide specific items of advice on what government should be doing. Get involved in the private sector, through consumer choices, through lobbying, through using social media. And hopefully we can provide advice on how individuals can do that. And definitely support international and local charities and non-profits, because they are typically at the front lines dealing with the people who need it. And our research can provide advice on these structures, on these approaches, on the values needed. So yes, ultimately, what I and my colleagues are doing, some of them can be quantified by the number of lives saved. Hopefully the importance is the long-term trends, the long-term changes that we need to improve everyone's health and to stop everyone experiencing disasters.
Right, a couple of times you've mentioned that your desire was to serve society. Where did that value come from?
We often don't know what influences us individually. What I can say is that I had a very fortunate upbringing, also because I sort of represent the majority in every way we can imagine, and that gives me certain advantages. And so I hope that what that has instilled is an ethos where I realize that I have had these advantages and a lot of people don't. So there's a long way to go. What affects us individually? What is a psychological makeup? Well, maybe another interviewee will be able to determine that for you. What I do hope is that taking the advantages I have had, taking the fortune I have had, instills this idea of trying to say, well, who does not have it? And how can I support them? Which also means helping myself. Because when we talk about serving society, it also has to be fulfilling for oneself. As I said earlier, I do like what I do. I'm very fortunate to have that. And it's going to be a balance between saying, well, what serves me and the people around me compared to the wider structures. Ultimately, where does this attitude come from? I really don't know. I guess that's for other people to do the research and tell me what is right with me and what is wrong with me.
That's brilliant. I think it's right. I think it's, that's one of the reasons I'm involved in this, is because I think we should, as individuals, we should be doing more to be involved, and because it's so easy to just be caught up in your own life and your own issues and your own family and what's happening to you, and that being your first and foremost and last function, and I don't think that that's how we should be living as a community. I think we should all be, if everyone did a little bit, we would achieve so much would change so quickly.
And thank you for being part of it, but I'm also cautious about self-flagellation, because family is important. And dealing with ourselves and people around us immediately, nothing wrong with that being first priority.
Right.
Plus the fact that we are very much constrained by a lot of the structures in society. So it's all very well to say, yeah, of course I would pay more income tax if other people would, but the current political climate in the UK is not going down that route.
Right.
So we're still caught up by the fact that we have more cash on hand because we're paying less income tax, but the library services are heavily constrained. And the health services are heavily constrained, and the social services are heavily constrained. Much as I would want to, I cannot change the NHS.
Right.
And even if I voluntarily paid more tax, that is not going to change the NHS.
Right.
So instead, I prefer to work towards these wider societal structures, trying to tell my politicians, we need the NHS, why don't you make it work?
Right.
And if that requires increased income tax across the board, particularly from those more affluent, I would gladly pay my share, knowing that my tiny contribution is part of the wider pool, which is making that difference. So can we take the burden of the world upon our shoulders? Absolutely not. We can do what we can as individuals in small ways, but we should not be self-flagellating, and we should not be detracting from what is important to ourselves immediately and day to day.
I agree. That's just, I think it's about having that, the balance. So it's you're doing some here and some there. And as I've always said, when I'm bringing up my daughter, she's 18 now, but my job was to train her to be able to function in society, and I guess that was my, how I'm serving the community.
What a wonderful contribution.
Having someone who comes in and doesn't destroy it with litter.
Which is all part of it. But the litter also creates a value.
Right.
And absolutely fascinating, I was working with someone who set up a teen first aid program in Colorado. And the initial idea was that everyone should know first aid. So if you start from the younger age, that will be a skill you have for life. So she brought it into schools. And it was a program that every single high school student, secondary school student who went through that particular school in southern Colorado was trained in first aid. What they found is that these teens were saving lives in the street. More to the point, they were starting to pick up litter. They were starting to look out for elderly people. They were starting to realize the value of the community around them and how they could and should contribute.
Wow, how did I can't even see how that would,
Become more
that
aware, I
connection,
suppose. It's becoming... Is it?
Well, it's exactly the question you asked me. Where did I get the values from? I have no idea. But when we start to talk about helping someone else and being prepared, being ready for it, so you have the confidence and the skills to intervene safely, then suddenly you think, well, maybe I can do something safe and healthy in other ways.
Right.
So maybe if we do train everyone, like you're training your daughter, to pick up litter and to respect people in the street, maybe that means she'll think, well, should I learn CPR?
Right.
Because that's helping people in the street. And should I learn first aid formally so that I know not to put myself in danger?
Yeah.
And so that I know not to put other people in danger. Because it's all very well seeing someone in trouble and rushing in to help them, but if you then hurt yourself doing that, we have 2 casualties instead of 1.
Right.
Your desire to help has caused more harm.
Right.
So again, where do we start? Maybe it's picking up litter. Maybe it's forced first aid, which then end up connecting.
I like the forced first aid, because maybe it is sorry, my mind's ticking now. Maybe it was the giving them a skill that can save a life, that they know that they're giving them the skill that they can, oh, actually I can make a difference with this. That this is, maybe that's a massive answer to a lot of problems. Like when you've got kids, instead of putting in all these, I'm not saying that youth clubs and stuff aren't useful, or or putting in all these music programs, or to be the next rapper or something, but it's like maybe simply teaching them first aid.
Well, and the life saved in first aid might be our own.
Right.
Because it's always about helping ourselves and starting with ourselves. What you've just articulated is actually a really key research question. Where do we start and how do we start?
Yeah.
And I think it's a very valid hypothesis saying maybe it's not music, maybe it's first aid.
Yeah.
Maybe it's not table tennis, maybe it's litter.
Right.
But we don't actually know. Because it could be music or table tennis, which then says, oh, you know what, there's other people.
Yeah.
And when you're in a 40-person orchestra, you'd better be a team player.
Right.
And when you're dealing with table tennis, you need to know how to win and how to lose.
Right.
And how to respect your opponent and move forward together.
Right.
Which then goes into these societal values about helping someone without harming yourself. And the societal values of saying, I don't want an ugly or dirty town. And it also stops flooding because there's connections. So join us in this research journey. And if anyone out there doesn't have a PhD, maybe consider it. If you don't have a master's, maybe consider it. If you're just interested in finding things out, join us and see what we can do together to understand. Again, just to encourage everyone to find out what works for themselves and what inspires them, and to ensure that we are always contributing, but contributing constructively. Because it is very sad that it's far too easy to inadvertently do more harm than good. So we must always think about what we're doing, understand what we're doing, and turn that into positive, constructive action.
Thank you very much, Ilan, for talking to us. Thank you very much for listening to us. We'll put links up to Ilan's work on our website, and our website is antiwafflepodcast.wordpress.com, and our Twitter account is @antiwafflepod. Please do get in touch, as we'd love to hear from you. Bye.
Bye.
Bye. Thank you.